That paper is together with my colleague, Dr. Walker, who's the neuropsychologist. And this is a problem that is to many of us, but yet is extremely incapacitating to our patients. The cognitive deficits in MS have been poorly studied, mainly because the tools have been lacking in past years. It requires sitting down and doing in-depth neuropsychological testing on patients, which is quite tedious. And then you'd have to repeat these tests over time. So we've been trying to simplify it with a modified battery of tests that get at some of the real difficulties that patients have in terms of processing. It's not that they can't get the answer. It just takes them a little bit longer to put things together. And it's that processing speed, which is probably the easiest to pick up with certain test results. Now, there are other issues that, patients are very fatigued. Fatigue is a huge problem for our patients. Physical fatigue, that's precocious, that is difficult to predict, and only recently had almost no therapies for it. But cognitive fatigue is also very apparent. Just like a person can set out to, I'm going to walk to the store today, I'm feeling great, and they'll get halfway there and they're overwhelmed with, I can't do this anymore, and they have to sit down. The same thing can occur in a patient who takes on, say, a simple project. They want to be able to fill out the form, and they get halfway through and they just can't focus anymore. They can't concentrate on it. It's precocious. And being able to pick that up in patients and then perhaps act on it is something that's part of ongoing research. And what we were talking about was the detection of it and being able to quantitate it. And then if you can do that, then you can introduce either a therapy, be it cognitive therapy or medication, and see if you can improve upon it, because that's a big aspect of some of the difficulties our patients have. Maintaining the focus on a particular subject mentally.